campaigning during COVID. That must be great. Yeah. All right. Hello, everybody out there. First of all, big thank you to Stephanie taking time out of your busy schedule to talk with me today. This is going to be shared up on the radio show's Facebook page, along with kind of streamed across a bunch of Stephanie's pages and whatnot. If you're just tuning in on my Facebook page, this is part of our interview series for the Hood Rat Strategist radio program, interviewing the candidates going into the August 4th primary. It's very important. Again, if you don't know your polling place, you can always look that up online with the Secretary of State. Also, keep in mind, Michigan, the no reason absentee ballot state, which is coming in very useful during the COVID-19 crisis. You can go to their website and apply for one. Easy peasy lemon squeezy. Again, Stephanie, welcome. Thank you so much for taking time out of your day to answer some of these burning questions. And as you mentioned earlier, if folks who are listening in, you got questions too, we'll also try to field those. Actually, I'll ask real quick before we get into our first question. What's it been like running for office in the middle of a global pandemic? We were chit-chatting about this before the interview started, but I thought that this would be kind of an interesting question for the listeners at home to hear about too.
Well, hey, Andy, and good morning. I am Stephanie Moore, and I am a candidate for the 60th District State Representative, and campaigning in COVID-19 has created its challenges, but it's also been helpful in terms of being able to just check in on people. We have most of the folks are sheltering in place. Many people have not been out of their homes in months, and some who have been out have only been out for essential, necessary things. So just checking in. Hey, how are you? How you doing? Do you need anything? Do you need a referral? Has anybody been over to actually do a visual check on you? And we've been communicating primarily with voters via social media, email, and text messaging. We have two different styles of text messaging that we use. And so voters are able to respond to our campaign, ask us questions. We are able to follow up, send referrals, or get information. And then lately, we have not, Andy, been knocking on doors. However, we have been out in the community just doing lit drops, putting campaign literature at the homes of registered voters. But during that time, we're able to see and talk to a lot of people because people are outside walking, jogging, they're at the park, they're pushing their baby stroller, they're walking their dog. And so there gets the opportunity for conversation. And of course, we're always masked, wearing our face masks, we're doing the social distancing, but we're having the opportunity to actually talk and touch bases with people in the neighborhoods.
Okay, that wonderful. That is so great, and I'm glad that you and your campaign are being so conscientious about taking those precautions. This first one, this is a hard one. I'm sure you haven't gotten this question ever. What made you decide to run for this seat? You ostensibly be replacing John Hoadley as our 60th district representative up in Lansing. But yeah, what made you decide to run for this position?
Absolutely. So I decided about a year ago to run for the 60th District State House, mainly because I've had so much experience at the local level, serving as a city commissioner, now a county commissioner, serving in board leadership, dealing with budgets, policy, making sure that we have everything that we need for individuals in our community. I also, Andy, serve as the chair of the Community Service Charity Board for the 60th District. So I'm very familiar with the budget, the policies, the program, and the connection between the 60th District Service Office and the overall Kalamazoo community. And so once I realized that everything really trickles down from the federal to the state to the local, in terms of dollars for funding programs and projects, in terms of the policies that pretty much pushes the agenda of the issues that we care about: housing, urban development, transportation, childcare, healthcare access. I really wanted to make sure that we had a champion at the state level to address all of those issues, knowing that Representative Hoadley would be term limited, running for another office. It was an open seat. And I was actually tapped by several different people to say, hey, you need to run for this. And I was kind of like, I didn't know, but definitely I made that commitment. I'm prepared and ready to do it.
So kind of a follow-up question to that. So again, it kind of part of my next question was going to be kind of focused on like how you think that experience preps you for it. But I want to just a little bit more specific. Being the work that you've had here in county, particularly in Kalamazoo. What kinds of what elements of your experience, and also like kind of the needs and outlooks of our community. Why do you think that's important to bring to Lansing, and how do you see yourself doing that?
Absolutely. So one of the things that I think is extremely important for particularly a policymaker at the state level is to understand the programs, to understand how it works with the organizations, the businesses that are on the ground, literally touching and seeing the people every day. So if I understand how it works in terms of if you create this specific policy around housing, it has to have a impact on my life that is going to make it better, right? And so, for example, I want to give you an example. A few years ago, we had a housing policy that said if you were homeless, in order to receive services, you had to prove that you were homeless. And the only way that you could prove that was going into a shelter and they write you a letter to say this individual is homeless. Well, what we learned, many people, particularly women with children who had a prior incident of some type of abuse or assault, were very, very hesitant to go into a shelter. Most times they wouldn't go, and they definitely would not take their children. But these were the people who needed access to the support in order to gain permanent, stable housing. And so we had to figure out a way of how do we give access to the most vulnerable people in our community? And it was by changing that policy. And so when you understand how it works, how it trickles down from the state level to the local level, and how it actually touches or not the people who need it the most, then you'll be more successful at pinning policy, supporting policy, and working with other legislators to make sure statewide that we're not creating more barriers for people. And so being a community organizer over 25 years, doing grassroots, actually grass seed organizing, understanding not just the organizations, but having relationships with the people and understanding the rhythms, if you will, of the culture and the community, I think plays a really vital part of being a good legislature, understanding and representing and championing for the people in the 60th district.
Oh, thank you so much, Stephanie. Now we're gonna kind of get into the issues here. Let's all buckle our seatbelts, as it were. No. But this next question, obviously, this is airing as of July 16th. This summer has been full of a resurgence of protests and uprisings against racism and police brutality. And I know that you've been doing some work around a county resolution. I was wondering, maybe give folks just a little bit of an update on that, but I also wanted to tie back into your campaign and kind of your intentions as a state representative. So I wanted you to kind of talk about that a little bit, but also just what solutions you think are needed at the state level, and also, do you support defunding proposals? And if so, how would you want the state to go about that?
Absolutely. So a couple of things. I just want to go back a little bit in terms of the resolutions that I introduced at Kalamazoo County government. One is racism as a public health crisis. In Kalamazoo County, the state of Michigan, and across the country, one of the chronic issues that we're dealing with is infant mortality, the rate that Black babies die then they're 3 times the rate as their white counterpart. We're also dealing with the social determinants of health, substance abuse disorders, mental health, physical health. And when you look at it, particularly for Black, Brown, Indigenous, people of color, the underlining issue is racism. And so being able to talk about issues that we want to really champion and move the needle on, we got to have conversations about racism, structural racism. It's part in how many people have these health disparities or these poor health outcomes, if you will. So that was one resolution that I introduced. It's also been introduced and passed in other local governments and states across the country as well. The second one was to end police brutality. We know that racial profiling is real, over policing, excessive policing in certain areas, particularly in the urban core, the inner city, and minority communities. We understand that most people are in the criminal justice system merely from an interaction that they've had with law enforcement. And so it could have been an innocent, started off as an innocent interaction and escalated. And police have a lot of discretion on what they decide to send up to the prosecutor to ask to be prosecuted. And so it was important, particularly in the light of Black Lives Matter movement, the deaths of so many Black citizens who were unarmed, who were not a threat to police officers, and yet lost their lives in that interaction. And so it was important to say here in Kalamazoo and even in the state of Michigan that we need to end police brutality nationwide, that we should have a focus on maintaining life. We should have healthy relationships between law enforcement and its residents so that they protect and serve and maintain life. And we should also be able to trust and be able to, work with our local law enforcement as well. Even when it comes to ICE and those folks who want to remove people, residents in our community, we want everyone to feel safe, welcome, and at home, regardless of where you come from, your culture, your ethnicity, or how you identify who you love. And so that's really important, not just to me and to the Black community, but all of us who are vulnerable, who are susceptible to police brutality. Your last question, yes, I do support the call for defunding the police. I want to be clear on one thing, that it's not saying that we take 100% of the funding all at once, and so then there's no police force that exists. That's not what this measure is. It's a long-term, over the course. One of the things that I do support, Andy, in the short term is that police officers are expected to be therapists, social workers, case managers. They're expected to do all of these things outside of policing that I don't think many of them are doing a good job at. So we need to immediately remove that funding from police and put it back where it's supposed to be, where the clinicians, the licensed therapists, the certified social workers, the community organizers, the people who have the relationships, the credentials to deal with some of these social issues, that money needs to go where it needs to be so that it can be properly implemented. The fact that the police officers are doing more than police, and then they're over policing and excessively policing, is not helping our community at all. I think we need to redirect the money from our budgets, city and county and state budgets, because for most of us, 60 to 70% of those funds go to law enforcement, and it's not working for us, and particularly the majority of us who are the most vulnerable.
Oh, thank you so much, Stephanie. And just a little bit of historical context for the folks watching at home. What Stephanie's referring to. Something we've talked about on the show a lot. A lots of social programs over the last several decades have been massively defunded. Kind of neoliberal austerity. It ends up in a lot of these urban communities. A lot of times, police are the only institution that is actually well funded. So as you said, whatever your view on policing, they really are expected to do way too much. Their purview. So this next one, we're gonna kind of shift gears a little bit. We're gonna be talking about this next question is about climate change. I always try to frame it as locally as possible when I'm talking about these issues. And, I think climate change is going to affect Southwest Michigan in some very unique ways. Some of those unique ways that, I like to talk about. So, a lot of climate scientists up in Lansing, a lot of their projections, Lower Peninsula and Upper Peninsula, will be comparatively in something of like a Goldilocks zone. I believe the projections by the end of the century, if everything keeps going the way it's going, our climate is going to more closely resemble something like that of the state of Georgia. So there's a lot of unique issues and challenges that come along with that. So sorry, my notes are getting all screwed up. Okay, so in addition to environmental protection, I also think of this issue through an equity lens. We're looking at an area that is going to become increasingly popular because there will be certain parts of the country, the hemisphere, that are going to be much harder to live, whereas again Michigan is going to increasingly turn into more of a breadbasket. We also have issues of environmental racism that are linked in there, and the importance of a just transition. So in addition to kind of what I just brought up and spoke about, and again how that big picture can affect things like housing, gentrification, etc. What do you think is needed to address those particular challenges that climate change brings to our region? Just kind of in addition, I was curious, like, do you support something like a Green New Deal or similar programs, something that can enable a just transition for workers, make sure people aren't left behind? So there's a lot to that question. So yeah.
Absolutely. The short answer, Andy, absolutely. I definitely support the concept of the Green New Deal. I think that whatever we can do to make sure that we are that we are actual earth angels, making sure that we protect Mother Earth, making sure that everything that we do is going green, that we can make sure that we're creating jobs that's sustainable, that are green, our transportation, making sure that it is friendly to the, Mother Earth, recycling plastic, especially making sure our water, protecting water. Here in Kalamazoo, just 2 years ago, we dealt with residents not having access to clean water. Unacceptable. I had the opportunity as board chair to lead the PFAS water crisis, make sure that we had a proper response, early, accurate, and make sure we got clean water to our residents in a timely manner, and that we worked through intergovernmental cooperation with the city of Kalamazoo to get clean water hooked up, supplied permanently to those residents in that neighborhood. But even beyond that, Andy, we got to make sure that we have adequate, ongoing, consistent testing, making sure we're looking at PFAS levels and not just targeted in one area, but in our region, so that we can see if there's any type of compromise. We catch it early at the very lowest level. I don't think that you wait till it gets to a certain level and then you respond. No, we do everything we do for preventative measures. I've also served for several years on brownfield redevelopment and economic development. We know that a lot of brownfields are in places in the urban community where minorities and poor people live. And that means we are raising our families around a lot of toxins, where in other places they're actually extracted out. But in some areas, they're buried down underground, and we are literally living on top of or building buildings on top of them. And then when you talk about health, where you see the health disparities of asthma, upper respiratory infections, heart disease, obesity, all these things play into health because we're not protecting our environment, particularly the environment that poor, Black, brown, indigenous people of color live in. And so we got to be very active about social justice or environmental justice to make sure that it's across the board a safe and healthy place for everybody to live. In policy, plays a big deal in that. Your policymaker in Lansing and even on the federal level, make sure that the EPA and other agencies that are supposed to be protecting us from these toxins are doing that in a fair and equitable manner. And then you also got to make sure budget-wise that whatever we mandate, that it's funded. When we get to a point in Kalamazoo in our region and we have to address either a health crisis due by water compromise, or we got to look at brownfields, we got to have the money to be able to say we need to completely extract these toxins from our community at any means necessary. Not that, well, because we're trying to protect the budget and we're only going to kind of cover up, bury, and this and that. Absolutely not. We want clean air, clean water. We will not compromise. We want to get rid of the smell in Kalamazoo, on the east side. There's something wrong. There's a seepage there that needs to be addressed. And it's probably not at the surface. You got to go deep down and figure out where we've been an industrial city for so long with paper and plastic and automotive and stuff. All of these things, we got to do a purge of all of these toxins so that our children are actually breathing clean air, drinking clean water, and can be able to run, play, and grow and be promise ready without worrying about, what they're actually breathing in.
I'm glad you brought that up, and I have just a quick follow-up question. It kind of reminds me. So I grew up in the Edison neighborhood, and everybody knows the paper mill for so many years was a notorious hot button issue. And there was always a sense that, if it were a different neighborhood, there probably would have been more proactive provisions about getting those materials removed instead of having a waste dump site in the middle of the neighborhood. Of course, things have changed a bit over the last few years, but I wanted to just get your kind of position on environmental racism. A lot of people often forget that it's typically in Black and brown neighborhoods that are kind of turned into these sacrifice zones where there'd be high cancer areas, high amounts of pollution. What would you want to do as a representative in Lansing to push back against that and to highlight that as an issue of concern?
Absolutely. That is one of my main priority focus for my campaign platform. Education, equity, environment, and economics is the top of my list. Environmental justice is extremely important. Like you said, living in a place where making sure it's not impacting our overall health. I have to tell you that working at Kalamazoo County really gave me the experience because we are the home of Health and Human Services. So you can literally look at Kalamazoo County government's website, go to the health department, and you can look at some of the health issues and health outcomes of all residents of Kalamazoo. And you can pinpoint by neighborhood, by zip code, by county district, where you have the greatest disparities. And no matter what the other issues is, the environment plays a huge part in that, where you live and how you live. I want to give you an example of sometimes we think about having access to things. One of the things my husband recently, and thank my husband, just purchased me a new vehicle. And he, as a retired veteran, is very environmental conscious. And so he wanted to make sure that I had a vehicle that was environmental earth friendly. So that way it turns off when it's idling and all this other good stuff. People like me, I just drive the car. I don't know about the other gadgets. However, when you talk about people who would love to do things like this, but can't afford environmental friendly vehicles, when we're looking at building new houses, doing new builds or rehab, looking at making green roofs, talking about solar energy, all these things. But the issue is affordability. Not everybody can afford to do things that are more environmental friendly. And those are the things that we need to look at to give people more access in an equitable manner. Another thing that people don't talk about a lot, Andy, is infestations. We just saw on the news headlines in an apartment complex where over 300 children live. Rats, mice, and roach infestation. That is a horrible living condition for any person. And what they didn't mention really was the issue of bed bugs. So now you got all of this infestation that brings all of this toxins and just an unclean environment. But yet we expect these children to be well behaved, to go to school, to be promise earning and promise ready. We expect them to not have any issues when they're not getting a safe place to sleep, good sleeping hours where they're taking in all of this stuff. It's not healthy. And when you look at health outcomes, health disparities, all these things play a part in that. And someone just mentioned in the comments about water, Andy, about the flood zones in the Edison neighborhood, where people are living with mold, mildew, because their homes have been compromised because of water flooding in their area. Again, we're talking about the urban core, the inner city, the individuals who may have homeowners insurance but not eligible for flood insurance, who end up having their homes compromised, and not because they don't want to get it cleaned or fixed or the water extracted, it's because of affordability. So when we're talking about environmental justice, you got to have access, you got to have the means and the education. A lot of people, we're talking about, or we believe in a lot of the issues, the language is different. How we talk about things, to be able to engage people, to bring them in. Many of us, Andy, want the same things: a clean, living, safe, stable environment, home ownership, own a business, be able to go to school, continue education, to have better health. We all want the same things. Unfortunately, those opportunities are not provided to everybody at the same equitable level.
Oh, that's so true, Stephanie. I think we're gonna pivot a little bit again, and you actually answered part
if
of
you
this
don't mind, Andy,
question.
can we do a quick little commercial break?
Oh, sure. No, actually, I'm gonna get some more coffee. That works for me. Yeah,
Cool.
I'll be right back.
All right, Andy, we had to pay some bills, as they say.
Oh yeah, no, that's quite all right. Yeah, who made those? I might have to keep that in mind if I have to help somebody else run for office in the future. But all right, that's another time. Anyway.
I kind of addressed that a little bit because you asked the question very early on about campaigning, particularly in COVID. Because I have done some work with a lot of great organizations, I end up meeting a gentleman who works for an organization called the Dem Labs, and they only support progressive Democrats. And this guy is a technology genius, and he's given me so many tools to use to be able to talk to, connect with, and empower voters, that those are created in-house, free. And again, those are some of the tools that he gave me to use to be able to be competitive on this campaign, mainly because we are not fully funded. We don't have a lot of money. My constituency primarily is grassroots, poor folks, and I'm very proud of the small donations that I've made, but even grateful for the tools and the techniques that he's given me to be able to use to share with you all.
Okay, great. Thank you, Stephanie. So these next two questions, they're both about healthcare, and you actually spoke a little bit to this earlier, so I'm just going to expand it out a little bit. I was going to ask you about, there's structural inequalities in our healthcare system. As you mentioned, Kalamazoo's got one of the highest infant Black mortality rates in the country. In addition, we've seen these healthcare disparities play themselves out during the COVID-19 pandemic. So, your resolution that about the declaring racism a public healthcare crisis. I was curious, how you would plan to, uh, uh, fight for this issue at the state level. How you do that once you ostensibly get elected in Lansing come this fall.
Really, I think a big part of this, Andy, is about policy. We have to look at how we are creating policy. And I want to give you an example. In local government right now, in our top management, there is no people of color who serve. In our health department, in our top management, there are no people of color who are serving, making decisions, actually helping with the development of policy and programming, right? If you look at the health department right now, at our statistics online, you can find it. Sexually transmitted infections and diseases is at the highest rate in Kalamazoo County. I think we're number 3 or 4 in the state, right? Yet you can also look at this geo map and it will show you exactly where the highest rate of infections are in Kalamazoo County. STIs, STDs. You follow me? Now, with Kalamazoo County, for whatever reason, we are not in the community, in the center of the hot spots where these infections are, giving medication, healthcare, and healthcare access to the people who need it the most. So my question has been, why? And they're saying, well, we don't really know where to go, and we don't know what office to hold up at, and we don't have the relationships in the community. Whatever you want to do, where you want to have a great positive impact on the most impacted people, you got to know the community, have relationships so that they can trust whatever you're bringing. Remember now, we all know about the Tuskegee experiments and all this other stuff. You got to have the right relationships so people will welcome you in, tell the folks to come and get the services, and they will trust that you will deliver them good services. That, Andy, I believe starts at the top, at the legislation that says this is what the community needs. This is the policy that sets it up, that in turn fuels how the program is actually implemented. We're also talking about health care and health access. We want to make sure, for example, in Kalamazoo, we have our federally funded health care facility, the Family Health Center. We want to fight to make sure that those federal dollars are coming to our community in an adequate number. The Family Health Center, and this is perfect. You talked to me about COVID-19, right? Mm-hmm. When the COVID-19 pandemic broke out and Kalamazoo learned what was happening, number one, Family Health Center was not at one of the first health offices to be notified. When they are seeing over 780 people a week at the Family Health Center, over 5,000, people on the road there, patients at that clinic. Why were they not immediately informed that this is happening? Have your testing available, and here's your toolkits and your resources. Andy, you might be surprised, and maybe you might not be, but when the testing kits were handed out in Kalamazoo County, guess how many Family Health Center got?
Is it somewhere between 0 and like, I don't know, like 50? It's a really low number.
You're so close. 52.
52
tests to last them from March to, actually it was from April to September. And remind you, I said they see over 750 patients a week, right? So we want to make sure that when people, whether if it's a pandemic, whether if it's dealing with chronic illnesses and diseases like diabetes, heart disease, upper respiratory disease, cancer, all these things that we are most impacted, Black, brown, people of color, indigenous people, we're most impacted. We need to make sure that those resources are readily available on the spot. So when you talk about what happens in Lansing, you need somebody at the table that says, you know what? We have these facilities that are touching and seeing and providing health, wellness, treatment, holistic health. to individuals, and they need to be at the top of the list to be able to respond to a pandemic or to even ongoing chronic diseases. And healthcare is important. I want to give you my personal story really quick. I started seeing my health practitioner, my primary care, imported at a facility, right? And I hated it. I walked in, no one looked like me. Nothing on the walls, the picture represented me or my culture. Even picking up a magazine while I was in the waiting room, most people didn't speak. They didn't say hi. They didn't welcome me. So even when I had to have health services, I did not feel comfortable there at all. But I love my primary care. When I got back there in the back and I finally got and met with her, she gives me the best services from the Rudy to the Tootie. Like, I love Karen, right? She ended up leaving and she left Portage and she went to Three Rivers, where she's been for the last several years. I actually go to Three Rivers every time I need to see my primary care physician. What about the people, Andy, who can't afford to do that, who don't have transportation options to go do that? What about the people who really need healthcare services and are not getting them in a safe and welcoming and representative environment? So most times what they do is they don't go, or they go when it's chronic, when it's exasperated, right? They go to the emergency room, but they don't follow up with their appointment, not because they don't love their life or they don't care about themselves. Most times it's not accessible, affordable, and it's definitely not welcoming or multicultural. And the individuals, most times, not everybody, that are working in our healthcare field are not multicultural competent. They're not talking to and relating with individuals, and not just because of color, but even on sexual identity. You know, people that are trans, queer, or whatever are subjected to a lot of things that impact their ability to have real access to health. That's important. We got to make sure we're creating a space and we are having people that are working in these places that respect us, that welcome us, and provide us multicultural competency, especially when we're talking about trauma informed, and so that we can have health plans that are mirrored towards the trauma we've experienced from children on up.
Thank you, Stephanie. And also just a particular thank you for upholding that piece on health for trans folks, you know, especially, you know, right now with that very like draconian stuff thing that just came down from federal. Very important to have people at the municipal, county, and state level who are going to go out and try to protect our people.
No, we're going to do it. We're going to protect our citizens.
Oh, yeah. So here's this might be a little bit of a quicker question. Just curious about your stance on healthcare overall. If you were in a situation where you could rally enough support in the state house, and you know, as we say ad nauseum on the show, Medicare for all, it's one of the most popular bipartisan supported pieces of legislation for American people. Politicians, not so much. But hypothetically, if you could rally enough state support, would you pursue a single payer program at state level? Just for comparison, I think when Abdul was running, he was pitching something similar to this with kind of a Michigan Medicare for all type program. Is that something that you would support?
Absolutely. So I believe in Medicare for all. I believe that everybody should have access to medical coverage so that they can access adequate medical care. I'm starting now at the Kalamazoo County level. I've been working with the gentleman, Bill Farmer, and another group of folks. They were having a hard time getting this issue to be a resolution introduced at Kalamazoo County. I carried it all the way. It's on our agenda. We've already had a discussion. At our next meeting, we'll be looking at supporting a resolution which calls for Medicare for all in Michigan, asking our state legislature to support that. So yes, I will support it here locally at Kalamazoo County government. Absolutely yes in Michigan. If we want to change the trajectory of where we're going, we got to give everybody health care or health access so that they can have access to health care. And it's not political to me. Maintaining health is important. It's a human right. It's expected by me. And if I got to go in and definitely got to cross the aisle and talk to people and work on relationships and educate people on the importance, because this is the thing, Andy, when you got healthy people, you got a healthy workforce, you got a healthy education system, you got healthy young people that are graduating and going into the workforce, you got healthy business owners who are sustaining their business and employing other folks. Health at the end of the day is the underlying issue, is that pot of gold that everybody needs. Your health is your wealth. And I'm committed to doing whatever I can to make sure that people have access to it.
Thank you, Stephanie. Okay, so we've got a couple questions left. I know I've got to skedaddle in about 10 minutes or so. Actually, there was just a question on there. You know what? I would like you to answer this question, but it actually ties in to the question I was just about to ask. A lot of residents in the area, they're increasingly concerned about gentrification, cost of living increases. I'm just going to say, as an aside, I do this radio show. I also do organizing work. Been organizing around building a renters union. We've been getting a lot of feedback. People like very high rent increases this season, kind of dubiously high. What would you do as state rep to help maintain affordable housing? And I was wondering if you could also tie a little bit of that individual's question into your answer as well.
Well, let me tell you, I'm going to build on the work that I've continued to do right here in Kalamazoo County. Number one, we have to maintain home ownership, Andy. For those individuals who are fighting to maintain home ownership that live in their homes, I'm going to fight against foreclosure, for mortgage foreclosure and for tax foreclosure. When it comes to renters, I want to look at the policies when it comes to homeowners, property owners that are renting their properties. One, because we want to make them affordable to the people that live here. Two, we want to make sure that they're decent, they're healthy places. In Kalamazoo County, unfortunately, we have a shortage of housing. Our housing stock, number one, is old, which means people are dealing with infestations, mold, mildew, insects, all of those things. And yet the poorest of the people are paying the highest amount of money for rent and utilities because of the housing condition, and therefore it's not affordable. We need to look at some policies that give some regulation so it brings some relief to individuals that are renters. Housing is not everybody should have a right to decent and affordable and healthy housing. The other thing, the main thing, Andy, is we got to look at a living wage. We have people that are working 2 and 3 jobs and a side hustle over here, and the kids are working and this and that, and they still are having a hard time maintaining their family. These are not lazy people. They don't want to live on the welfare system. They want to work. And we should be paying them a living wage so that they can afford to live wherever it is that they desire. They should not have to be stuck in a certain neighborhood to live in certain housing just because, they can't afford it. So we got to look at the root causes of why people are struggling so much. And that's because the state and federal government are not giving them what they deserve, what they have earned as residents in this community that are giving back every single day. And then I want to say that when it comes to the ending the whole thing, we know that the governor just ended the moratorium on evictions. We're going to see the floodgates open up with landlords coming in left and right. But first of all, we're talking about landlords who are charging people rent who really, truly can't afford it at a time where they lost income, didn't have access to unemployment. Most people didn't get their stimulus yet, or they got it so late, and now they're racking up all of these fees. I want to work with the circuit court and everybody else that, number one, take those fees away, especially during this COVID pandemic time. And two, we need to regulate what is a reasonable amount of rent. I have some people living in a 1-bedroom, 1.5 bedroom, paying $1,200 a month plus utility. Crazy. I live in a home, a 5-bedroom, and my mortgage is less than $600 a month. We need to get people to home ownership. I don't want to spend any more money on temporary housing. I'm probably going to get in trouble, Andy, for saying this, but I was heartbroken when the city of Kalamazoo spent all that damn money in a hotel. First of all, where did that money come from? If you had millions of dollars on reserve, to house some people, then we should have been rehabbing, building. We should have been putting folks in housing so that they would have been stable before pandemic. Okay, so now we've had the pandemic and we learned we need to take whatever reserve is left and whatever else we can raise and rehab and build and create permanent housing. I'm not against the shelter, but I'm not going out to raise money for the shelter because people need to raise their family in permanent housing. Lastly, I want to say in terms of the contracts, the question that was asked about the local businesses, yes. The city of Kalamazoo, yes, has funds through their nonprofit arm where they're doing work for small businesses, minority-owned, women-owned businesses. They're helping them to get their plans done to become bankable. And through the CARES Act, there are dollars that are available that are in the form of loans, but they are forgivable loans. So people should go to the city of Kalamazoo. You can just call 311 and tell them you're looking for those resources that'll connect you directly to the city through those departments. And there's organizations like LISC, Local Initiative Support Corporation, and some others that are helping to, in Southwest Michigan First, that are helping to disperse those dollars. But Andy, our priority right now, particularly at the local level and the state level, is making sure that all renters are protected, that property owners, especially those that do not live in this county, let alone the state, that are renting these properties, that they do it in an affordable manner. And they are responsible for maintaining these properties so that they are decent, affordable, healthy housing. The majority of the properties that are being rented are people that have no skin in the game. They don't live in this community and damn sure don't care about the people who live here. And we need to change that.
That critique of the city, I think it kind of goes back to that whole idea of trying to come up with structural solutions versus very expensive band-aids, really. Okay, so 2 more questions, then we're gonna wrap things up.
Because we wouldn't have had this problem if you were at the city commission.
There's always let's see, a year from now we'll see, but I don't know. I think right now I'm trying to find somebody else to that's a discussion for another time. All right. So, but thank you. I appreciate that. Last couple questions. This is our last big question, but voting is a critical issue going forward, especially amidst COVID-19. What are going to be some of your priorities to improve voting access? And pointedly, do you support certain election reforms that can lessen the role of money in politics? For example, things like publicly financed elections, ballot vouchers, ranked choice voting, and also, again, we've got. I am very concerned about the November election. I've been kind of warning people. Voter suppression has been very bad in the last several election cycles. It might be the worst we've ever seen, at least in the modern era. So just kind of like your political priorities with that, and just kind of preparing for this upcoming election.
Absolutely. So a couple things. I'm putting my website up here on the screen for individuals, not because you can go check me out, but because you can register to vote on my website. You can also request your absentee ballot on my website, more-2020.com. You can also verify if you are registered to vote and where the precinct that you vote to via my website. I'm linked directly to the Secretary of State. So it's very important that you register, verify, and have a voting plan. Or if you're doing your absentee ballot, request your absentee ballot now so that you can get it in a timely manner, get it filled out and return it, mail it back to the clerk's office. I want to remind people that if you are doing absentee ballot, that you do have to add postage to your ballot when you mail it back, or you can just take it back to City Hall, the township, wherever your local jurisdiction is. But make sure that you are properly sending it back. I also want to tell you, too, that you cannot give your ballot to someone else. If you have an absentee ballot, you have to return it yourself or return it by mail. It's illegal for people to come over, pick up your ballot and say they're going to return it and do it, whatever. The other thing I want you to be aware of is that we have had issues at our Kalamazoo County Clerk's office. Anybody that knows me or have been paying attention or in tune understand that I've been raising those issues. Andy, as a result of those issues, our election has been compromised in a district that we know of, Kalamazoo County District 5, where absentee ballots were printed with the wrong candidates on them. And so we've caught that error. We've had a chance to vocalize that and make it public. But now the township clerk is scrambling, trying to reissue those ballots to those individuals so that they can revote. Major voter disenfranchisement. So I'm going to say to everybody, please look at your ballot, double check. Go to the website and verify that you're in this district. This is what your ballot should look like. And these are the candidates that should be on there so that you are voting the correct ballot. If you're not, contact me, your local clerk, contact Andy, anybody that you trust and say, hey, I'm suspicious of this. This doesn't look right. Andy, I've also been contacted by an individual who said that their ballots are not completely printed. So if that's the case, you need to get a ballot you can read and you can complete. I want to say that today, at 3:30, I was able to get our Secretary of State, Jocelyn Benson, to talk to Kalamazoo County residents specifically about voting, the process, their rights. So tune in live right here on Facebook. There's a link I've already posted it. I'll reshare it again shortly. If you got questions, if you care about equity, in this election, please tune in and get it straight from our Secretary of State of what to do. Second of all, when it comes to public financing of elections, hell yeah, I support that. Andy, you might not know this, but as a community organizer, when I started off 26 years ago, I worked for Michigan Citizen Action, and that was the issue that we were organizing on. Full public financing of elections. Take big money out, PAC money out, dark money out of the elections, and allow people like me and you, Andy, who are serious, committed individuals, candidates running for office that care about people and not about money, to take that money out of politics, level the playing field so you and I have a real chance of being in the room at the table, penning policy that's going to help create a better quality of life for everybody. Should people have access to voting for individuals that look like them, that are inspired by their message and equity and equality? Absolutely, yes. We need candidates like you and I that can be able to do that, and be able to afford to do that. So we need to level the playing field at all costs. We need to get the corruption out. I love the quote by my shero, Shirley Chisholm, the first Black woman to run for president of the United States, unbought and unbossed. So that's what we need. So people in Lansing at the federal government, we're not beholden to special interests, but to the people who elect us, who live in the communities that we want to serve. Lastly, I just want to say that know your rights. It's important. If you don't know, have these conversations, tune in these dialogues. Andy is a champion for this work. He's on the radio, on his social media page. There's so many people that are doing this work. You don't have to be the expert. Just talk to people and have these kitchen table conversations of how we all come along and get along, basically. And then I think there was one more part of your question. I forgot what it was, but I know I supported it. Oh, wait.
Okay. But I wanted to let, just real quick, people want to find out more about your campaign, if they support it, how they do that.
So basically, you can definitely go to my website, which is more.2020.com. And you can actually, let's see, here we go. You can go to the website. You can, like I said, do all your voting stuff there. You can donate. You can sign up to volunteer. You can be a part of the campaign, sharing the word. I'm on social media, Facebook, Instagram, Twitter, LinkedIn, YouTube, and I'm very grassroots. Someone asked on the comments earlier about getting a yard sign. Yard signs are available, particularly if you know where I live at. They're on my front porch. Come right on Patterson Street, walk on up, grab your yard sign, however many you need. Just wave at the camera. You know, we got the little camera out there. Do your little dance. And we're out there. We're in the community. We're contacting and reaching and touching voters. I'm going to do more platforms like this. We're great people like you that are talking about what's happening. But more importantly, Andy, what I need people to do particularly is I need for you to vote absentee ballot or go into the polls. Every poll precinct in Kalamazoo County will be open. You can go in, wear your face mask, do your 6 feet social distancing, get your ballot completed and cast it. Put it in that ballot box so that your vote can be counted. I'll be posting some information about election protection soon. If you have any issues with voting, you definitely can call a number and get legal help for that. But you got to tell somebody. We got to turn up voting like never before. And remember, this is a primary, Andy. So you can only vote one way. You can only vote Democrat or Republican. You can go down and circle in who you want to vote for. Or if you don't want to vote for certain people, you don't have to circle it in. But I'm encouraging every single person, if you're not registered, register now to vote. If you're not sure where you vote at, then verify right now where you vote at. If you want an absentee ballot, get that absentee ballot right now so you can do that. And have a plan of going in the polls. They open from 7 a.m. to 8 p.m. As long as you're in there before 8 p.m., you have a right to vote. Andy, we saw this play out in Georgia just a couple months ago for their election. We waited in long lines. The suppression was real. We need to do everything that we can do to protect folks. And lastly, I want to wrap it up with this. Please donate. Donate to the campaign. We need your financial support. That gives us the ability to reach voters, to have yard signs, to do mailings, to have radio advertisements, and also to do the voter protection work, particularly since we know a lot of ballots are incorrect. Right now, we only know of over 750. That's what we know of. So please donate. You can do Cash App Stephanie Moore 2020, or you can go online to my website, more-2020.com.
All right, thank you so much, Stephanie, and all y'all listening out there. Again, we're going to be having some more candidate interviews, and remember, the primary is August 4th. Thank you, Stephanie, and have yourself a lovely day.
Thank you, Andy. I appreciate you. Bye-bye. So, I want to end with a quick video for you all. Hi, I'm Stephanie Moore. Education, economics, equity, the environment. You can expect more with Stephanie Moore. Vote Tuesday, August 4th. Elect Stephanie Moore. Education, equity, economics, the environment. Expect more with Stephanie Moore for the 60th District. Vote Tuesday, August 4th. Elect Stephanie Moore. Hi, I'm Stephanie Moore. Education, economics, equity, the environment. You can expect more with Stephanie Moore. Vote Tuesday, August 4th. Elect Stephanie Moore.